people ask, oh, do I need surgery? And I always ask them, well, do you feel like you need surgery? There's things that you don't get a choice. Like I said, somebody that, has a fracture that is not going to do well without surgery, and I tell them that. But most things, it's a lot of gray area in medicine, and it's really up to the patient how much it's bothering them.
I'm not going to just do a surgery because there's a surgery to be done. I'm only going to do what you need to help you. Sometimes a treatment requires surgery. Sometimes a treatment just requires therapy and time.
What I want patients to know is we try to give them an honest opinions on some of the complex problems where they're looking for a solution, and the solutions aren't always a surgical solution. And so sometimes patients come to us wanting surgery, and I talk them out of it or say, go try other things. I want them to know that just because they're seeing a surgeon doesn't mean they have to have surgery, and we usually offer them non-surgical options.
The days, to me, are way gone of the surgeon going, here's what we're going to do. What I want patients to know is that they have a say in what we do. If they come see me, it's not, I'm just going to be like, yes, we got to do this. In most cases, you don't got to do this. Most cases, you have choices.
Most surgeries are elective. There are a few things, unless you've broken your bones or things like that you have to have surgery. But for the most part, it's an elective process. And so, again, I give them the option of, okay, here's a surgical option that we can do for you. But they should know that I'm giving that advice to them as I would to a family member, that if I think that's an option, it's a good option.